These are typical lateral fields. If you're doing conventional IMRT or conventional head and neck treatment planning, and you abut that to an electron field, and you know that there's dosimetry is questionable at an electron-photon beam junction. Also, there's no way to do a concave dose distribution, so you can't shape. That's the reason why we need this electron field, is you can't shape the dose distribution adequately around the spinal cord to increase the dose to the target. Indications for IMRT, you definitely need cooperative patients. If you have patients with resting tremors or patients who are claustrophobic or uncomfortable in a mask, they're not going to be a good candidate because of moving. A reduction of normal tissue complications is an important aspect for IMRT, and there's plenty of literature in the data now, data in the literature to support that. To escalate dose and improve local regional control is another indication, and of course the dosimetry aspects of IMRT can be much better than what we get with conventional photon electron beam matching. As I mentioned, there's little or no intrafraction organ motion, and setup uncertainty can be controlled to an acceptable level with IMRT without any heroic immobilization devices. Just typically what you find off the shelf is usually adequate to get yourself within 2 to 3 millimeters of accuracy. So let's look at some of those immobilization techniques and the issues surrounding immobilization for head and neck. For head and neck IMRT, it's not just one site. You're not just looking at immobilizing the patient's head. You also have to be concerned with the supraclav region, because you're very frequently treating lymph nodes prophylactically all the way down to the supraclav or the mediastinum. So it's really a two-pronged problem where you need to immobilize the head, but you also need to immobilize the shoulders. And there's different ways to do that. You can have active types of immobilization where you actually fix the patient's head by some device, or